Hello, I'm Diana Keogh, Editor-in-Chief of Sharewith.com. Today we're talking with Dr. Cary Sauer, who is a pediatric gastroenterologist with Children's Healthcare of Atlanta at Eggleston. Dr. Sauer has agreed to take questions from our members that have come in over the internet about celiac disease. Dr. Sauer, I'd like to start with you explaining to the audience what the symptoms of celiac disease are.
Celiac disease can have a wide variety of symptoms which can make celiac disease difficult to diagnose. Certainly the most common symptoms are abdominal pain and diarrhea, but those can range all the way to constipation in some patients. Certainly poor growth is another symptom we often see in children, but it doesn't necessarily need to be the case. The most difficult patient probably to diagnose is the asymptomatic celiac patient, or the patient that truly does have celiac disease but does not have any symptoms. One of the other more common findings in celiac disease is skin rashes or other skin manifestations.
Dr. Sauer, how is celiac disease diagnosed?
A celiac disease is diagnosed with a blood test typically first. The blood test is very accurate and any doctor can perform this blood test. If it's positive, then we typically suggest moving towards endoscopy with biopsy of the small intestine to confirm the diagnosis.
Dr. Sauer, do you know of any reasons or any theories that are out there on why celiac disease is more common today than it was like 10 years ago?
I don't know of any specific theories that talk about celiac disease and why it's more common. It may just be a simple fact that we recognize it more often and we're checking for celiac disease more often than previously. There are no theories on exactly why celiac disease itself would be more likely today versus 20 years ago.
So I hear it's common for celiacs to suffer from anxiety and depression. Is celiac disease a cause for these disorders?
We certainly often see those depression and other diseases linked with celiac disease. And the difficulty is determining whether celiac disease or just chronic illness in general causes those diseases or whether there's a true biologic link. I think research over the next 10 to 20 years will really give us that answer on whether or not celiac disease occurs first and that chronic disease as well as not feeling well leads to depression and other symptoms.
Dr. Sauer, thank you for joining us on Sharewith.com. This has been great information. If you'd like more information about celiac disease and gluten intolerance, please go to our website at www.sharewith.com.